Hey guys, welcome to Med10. So in this video we'll be looking at the Meniere's disease, which is a very important topic for the university examinations as well. So what is Meniere's disease? It is characterized by distension of endolymphatic system with endolymph. So how do the patient presents? He presents with the symptoms of vertigo, sensory neural hearing loss, then he also presents with tinnitus, that is the ringing sensation in the ear, followed by a feeling of fullness in the ear, that is the oral fullness. So these are the four main symptoms that the patient presents with. So what is Meniere's disease? It is characterized by the distension of the endolymphatic system with the endolymph, where the patient presents with vertigo, tinnitus, sensory neural hearing loss, as well as the oral fullness. So how does this occur? So mainly it is because of since the stria vascularis, it leads to secretion of the endolymph. This endolymph is drained via the endolymphatic sac, which is the drainage. So whenever it is not drained properly, this leads to the excess of endolymph. So what actually happens? Following distension, filling with endolymph, this leads to the rupture of Reissner's membrane, which is there in the cochlear duct. This rupture leads to mixing of endolymph and perilymph. Mixing of endolymph and perilymph. And whenever their mixing occurs, it leads to an attack of vertigo. Okay, so this is the main basis on how it actually progresses to form a vertigo. Okay, moving on to the etiology. So what is the etiology of the disease? So mainly it is differentiated into number one, there is defective absorption by the endolymphatic sac. Okay, there is defective absorption by the endolymphatic sac. The second theory is based on the vasomotor disturbance. What does vasomotor disturbance mean? Due to the increased sympathetic activity, there is spasm of the internal auditory artery, and this spasm leads to exudation of the fluid. And this exudation of fluids leads to increased production of the endolymph. So this is what causes the increased production of endolymph. Third theory or third cause of the disease may be due to allergy. Due to allergy, there might be excess production of the endolymph. The fourth cause is the sodium and water retention. The fifth cause is the hypothyroidism. And finally, it may be due to autoimmune and viral etiologies. So these are all the etiologies of the Meniere's disease. There may be defective absorption by the endolymphatic sac, or there may be vasomotor disturbance leading to the spasm of internal auditory artery due to the increased sympathetic system, leading to exudation of fluid and causing increased endolymph. It may be due to allergy, sodium and water retention, hypothyroidism, as well as the autoimmune and viral etiologies. Okay, now let's look at the clinical features of the Meniere's disease. Clinical features. So what are the clinical features of Meniere's disease? Number one is the age and sex. Mostly age group affecting the disease is from 35 to 60 years, and most commonly males are affected more than the females. Okay. So what are the clinical features we have? As I told you, we have vertigo, tinnitus, hearing loss, as well as oral fullness. Okay, so firstly briefly describing about the vertigo. So the patient experiences sudden vertigo, sudden onset. Okay, there is no prior warning symptom of the vertigo, where the patient gets a feeling of rotation of himself or his environment. Okay, sometimes there may be a feeling of to and fro motion as well as up and down motion as well, and this attack is followed by a feeling of nausea or vomiting, nausea and vomiting as well. Okay, then there is something called as Tulio's phenomenon. What is Tulio's phenomenon? This is a condition where loud sounds produce attack of vertigo. Okay, loud sounds produce an attack of vertigo. So this is called as Tulio's phenomena. So what happens vertigo in these patients? It's actually sudden onset. There is no prior warning symptom. Okay, there is no warning symptom is not there. There is a sudden attack of vertigo followed by a feeling of nausea and vomiting, and the patient also experiences what is called as Tulio's phenomenon, where the loud sounds produce an attack of vertigo. Okay, then the second symptom or clinical feature is the hearing loss. This hearing loss, it is there after the attack of vertigo. After the attack of vertigo, the patient has a mild hearing loss, and this improves after the attack. Improves after the attack until the next attack. Okay, so this is what you need to know. It actually accompanies vertigo and may precede it as well, but after the attack of the vertigo, its hearing loss is generally improved. So this is about the hearing loss. The third thing we have is the tinnitus. So as you know, what is tinnitus? Tinnitus is a ringing sensation in the ear. Ringing sensation in the ear. So the patient may also experience tinnitus in the form of a low pitched roaring type sound. Low pitched roaring sound. So that is a form of tinnitus that the patient experiences. Finally, what the other symptom? That is the oral fullness. That is the feeling of sensation of fullness in the ear. Okay, then he may also have other features such as emotional upset because of the repetition of attacks with the unknown cause as well. So these are all the four main clinical features of the Meniere's disease. Age 35 to 60 years, males are more affected than females. He has vertigo, tinnitus, hearing loss, as well as the oral fullness. Okay, so vertigo, what is vertigo? It is a sudden onset vertigo where the patient feels that he is rotating or the environment around him is rotating, or either there is to and fro motion or as well as up and down motion as well, and this is followed by the nausea and vomiting, and also there is no warning symptom prior to the vertigo. There is something called as Tulio's phenomenon where the loud sounds produce vertigo. The patient also experiences hearing loss, which may precede the vertigo as well as during the vertigo he may have hearing loss, but it generally improves after the vertigo. Then he also experiences tinnitus, which is a ringing sensation in the ear as well as the oral fullness. Now moving on to the examination part. What are all the examinations that you would like to do in a person coming up with the symptoms of a Meniere's disease? Okay, examination. The firstly what you will do is a otoscopic examination. Otoscopy, you will just look at is there any abnormality in the tympanic membrane which is leading to the cause of hearing loss, or is there any foreign body in the external auditory canal. Otoscopy, then you have to check for the nystagmus, is it coming along with the vertigo attack. Then you should also do the tuning fork test to determine the type of hearing loss that the person has. Tuning fork test. Then what are all the investigations that you would like to conduct? So normally you would like to conduct almost all the investigations available in the ENT. That is, first one you'll go for is the PTA, that is the pure tone audiometry. Pure tone audiometry to identify the type and degree of the hearing loss. Then you will also do a speech audiometry. Speech audiometry, followed by you will also check for electrocochleography to check the function of the working of cochlea. Electrocochleography. Then the examiner might also want to investigate through the caloric test as well as glycerol test. You don't need to know about each of these individual tests. Okay, then what are the different variants that we do have in the Meniere's disease? Sometimes they might ask the variants of the Meniere's disease. So what do we have in the variants of the Meniere's disease? Number one is called as the cochlear hydrops. Cochlear hydrops. The second one is the vestibular hydrops. Vestibular hydrops. And what about the third one? The third one is called as the drop attacks. Drop attacks. And finally the fourth one is called as the Lermois syndrome. Lermois syndrome. So these are all the different variants of the Meniere's disease. So how do you diagnose a case of the Meniere's disease? Moving on to the diagnosis part. How do you diagnose if this is the case of the Meniere's disease? So diagnosis mainly depends on number one is the certain diagnosis can be concluded with the help of histopathology. Okay, with the help of histopathology we can confirm the diagnosis of Meniere's disease. Then there is a definitive diagnosis. Okay, what is the definitive diagnosis? If the patient experiences 2 or more attack of vertigo, 2 or more attack of spontaneous vertigo which will be lasting 20 minutes or longer. Okay, and he also has audiometrically documented hearing loss, and the patient also should have tinnitus as well as oral fullness. So this is a definitive diagnosis. And there is a probable diagnosis that the patient may be suffering with the Meniere's disease if he has just one attack of spontaneous attack of vertigo, and there is also an audiometrically documented hearing loss along with the tinnitus of oral fullness. Then it might be possible. Okay, then there might be possible Meniere's disease if he has just one attack of vertigo with no sense of oral fullness is all. Okay, so how do you treat the person with what is called Meniere's disease? General treatment will go to according to the modality. The first thing is the general measures. What general measures you want to advise for a patient with Meniere's disease? So first thing you have to do is you have to tell the patient is that okay, first thing that is there is the assurance, like there is nothing going to happen. You have to assure the patient that it is not a thing to be worried about. And if the person is smoking, you have to ask the person that he should cessate the smoking. So cessation of smoking is advised. Then you should also advise the patient on a low salt intake. Okay, because of sodium and water retention it may cause increased secretion of endolymph. So advice for the low salt intake, and also avoid excessive water intake. Avoid excessive water intake as well. Okay, then you should also advise on avoiding overindulgence in either the coffee, tea, alcohol. Ask the patient to avoid stress and also bring a change in the lifestyle if he is sedentary. Ask him to avoid activities which require a good body balance, because even that may produce an attack of vertigo. And how do you manage an acute attack? If the patient has an acute attack of vertigo, how do you manage it? First thing, reassurance that nothing is going to happen. Ask him for a bed rest. Okay, let him take rest. Give him IV fluids and electrolyte imbalance as well to maintain the electrolyte, and also give him vestibular sedatives. Which out of the drugs useful in vestibular sedatives? We have dimenhydrinate. Okay, then what about the management of chronic phase? If he has a chronically if he is having the symptoms, how do you manage it? The first thing is the vestibular sedatives. Vestibular sedatives. You also give him vasodilators, some diuretics to reduce the volume. Also you have to give him propanthelin bromide. and also eliminate if there is any allergen that is facing. Eliminate allergen, either the pets, dogs, or the area in which he is living in. Okay, then what we'll do something called a surgical treatment. Okay, what surgical treatment that we have to give? We have to give there are two procedures: conservative procedures and destructive procedures. In conservative procedures, the conservative procedures, then we have the destructive procedures. Okay, in destructive procedures we'll directly do the labyrinthectomy, we'll remove the cause. Okay, in conservative procedures what we'll do decompression of the endolymphatic sac. Okay, decompression of the endolymphatic sac. And what are the conservative procedure that you can do? You can do an endolymphatic shunt operation, you can do sacculotomy, or as well as section of the vestibular nerve causing the attacks as well. So this is what you can do. So this is about the general treatment of the patient with the Meniere's disease. General measures: you want to assure the patient cessation of smoking, low salt intake, avoid excessive drinking of water, avoid overindulgence in the coffee, tea, or alcohol, avoiding stress, and avoid activity requiring good body balance. Then if there is an acute attack, you will again reassure the patient, give him adequate bed rest, and also put IV fluids and electrolyte imbalance. If he is suffering from chronically, then you have to give vestibular sedatives, vasodilators, diuretics, propamethylene bromide, as well as eliminate any allergen that he may be suffering from. Then finally we will go on to the surgical treatment. We have the conservative procedures as well as the destructive procedures. In conservative procedures, we will do decompression of the endolymphatic sac. In the destructive procedures, we will do labyrinthectomy. We will remove the labyrinths. Okay, so thank you guys, thank you for watching till then. Make sure to subscribe and hit the like button, and I hope I'll see you again. Bye.